Well, good morning, everyone. This is Dave Rinebolt of Ohio Partners for Affordable Energy, and this is round two of Dialogue with Dave. I'm joined today with my old colleague and friend, Lisa Hamler-Fugitt from, what is it? What's the name of your organization officially these days, Lisa?
Ohio Association of Foodbanks.
Okay. Okay. The second harvest part isn't there anymore.
It still is. A number of our members still carry the Second Harvest name. We
Mm-hmm.
changed our name to align with our federal or the national organization, Feeding America. So we dropped Second Harvest, but everybody will remember us forever as Second Harvest.
Yeah, I certainly do. But let me get to the questions because I do want to have talk to you about what's been going on with your organization. Um, Obviously, we're in the time of COVID, and it's upended. I'm sure it's upended our service delivery, and I'm sure it's upended your operation in so many ways. Um, and one of those obviously is a huge expansion in the number of people that we're serving. So what are you seeing right now in terms of the population that's heading into the food banks that's looking for assistance?
COVID really exposed a lot for both as an organization, but I think it also exposed just how fragile and frayed the safety net was. We hit another record ending June 30th of serving over 2.9 million Ohioans through a local distribution. We had only just previously returned to the pre-recessionary levels of service demand, but we're feeding more and more low-income working Ohioans, people that were playing by the rules, but just weren't earning enough prior to the pandemic, more seniors than we've ever seen. Now about 40% of those that we are currently seeing at our food distributions report that they have never had to ask for help before. And that really is confirmed by the US Census pulse survey that's been done since the onset of COVID. So lots of new faces, lots of anguish, lots of despair.
Well, one of the things we've been dealing with is, with the energy, electric, gas moratorias went into place. So people weren't getting shut off. So that became less of a priority. And we are only starting now to see people come into the agencies, but it sounds like people started hitting the food pantries right away.
They did. And again, when the disaster was announced, disaster declarations went into effect, we were classified as essential by the governor. We were very pleased that the governor not only gave us that classification, but he also went one step further. He recognized that so much of our network was staffed by and large with senior volunteers who were the most at risk of COVID and were really encouraged to shelter in place. So at the same time that we were seeing this pandemic roll out and mass unemployment across the state, we lost our backbone. We lost those boots on the ground. So the governor did deploy the National Guard. So we've had a complement of over 500 National Guards members, soldiers, and airmen who have been really replacing those boots on the ground and have been with us since March. So we will have them and through the end of December. But our biggest challenge now is because of COVID, we're not seeing the numbers come down, maybe a leveling off, but we have not seen a return of our senior volunteer base. And because corporations now have so much of their workforce that are working from home, we're struggling to figure out how we're going to keep up with the sustained demand without the volunteers that we need to carry out the distribution of food.
What about the adequacy of your food supplies? Are you short there, or are you short of particular things? How's the supply look?
It's feast or famine. We were able to move up some of the deliveries the food supply chain is extremely brittle. Anybody that's been to the grocery store, you're still seeing empty shelves or shortages of some given items. The highly perishable foods that we need, the fresh fruits, vegetables, and lean protein items. We've received some of that through a new program that USDA started as a market clearing program, the Farmers to Food Banks. Right now, our greatest demand is in the area of protein, shelf-stable items, as well as personal care, personal hygiene, and household cleaning items. The very items that we all need to engender an active, healthy life, but you can't use food stamps to purchase those items. Food costs are now at a 50-year high. So what we were able to purchase a year ago, it's costing us 50% more to be able to purchase those items if manufacturers have them available. Again, our food systems are extremely brittle and supply chains have just not yet returned to where they were pre-COVID.
Wow. Well, and the disruption of supply chains is true across the number of things. For example, we went back into the field in mid-May, doing work with some of the programs, and that expanded. Right now, we're waiting on about 1,700 refrigerators.
Yep.
We can't get refrigerators. Yep. And so we've had to shut down programs early because in order to close out by the end of the year, we're waiting 3 months for a delivery.
And we're right there with you, and it's just across the board on and everything from food to consumables to additional key supplies that are available. I think COVID's exposed a lot, but I think that one of the things that it has exposed a shredded safety net, a very fragile and brittle supply chain, but also, and I keep telling people, remember, before COVID, in the strongest economy in more than a decade, we still had 1 in 3 Ohio households that could not come up with $400 to address an unexpected emergency crisis. They had no safety net. So they were the ones that were hurt. The other really sad phenomenon, it's been those who worked in hospitality and the service sector in low wage jobs already who have lost their jobs. And it's pretty clear 7 months in that many of those jobs in those businesses are never going to return. So what are we going to do as far as education, retraining, and retooling to make sure that the jobs that do come back, people are prepared and skilled to be able to take those jobs?
Yeah, I'm thinking in order to provide opportunities for those people at the lower end of the wage scale, we're going to have to do something like the American Reinvestment and Recovery Act. And as you know, that was real. We created 1,100 jobs as a part of that, and weatherization nationwide was the 7th largest job creator. And we can do entry level. But I don't know how we get out of this without a significant investment of government funds, infrastructure work. Maybe it's a good thing we haven't passed an infrastructure bill. We might get one now when we actually need it.
I agree. And I think the thing that's been the hardest for us is to see that the Senate has failed to take up the next COVID relief package in the HEROES Act and what that's meant to people. The loss of that $600 per week unemployment benefit or the pandemic unemployment benefit has been catastrophic. We now have people that were able to make it, that maybe were paying the rent every other month, who now have no income whatsoever. And they're really struggling. They're the ones that are falling behind. And while we have a moratorium on evictions, we already know in the state of Ohio that 1 in 4 renters are now behind in their rent. These are households with children. That moratorium, unless something happens, comes off at the end of December. So we're going to have a lot of low-income Ohio households who are going to be months and months behind in their rent. They're at risk of potentially losing their utilities as well. And I always say that, we've dealt for years with this heat or eat dilemma. 70% of those that were turning to us reported that they were making trade-offs between being able to pay their energy cost, whether it was gas or electric, and being able to afford the food that they needed in order to feed themselves and their families. So again, these trade-offs are going to be really critical, a lot more pronounced than what we've seen in the past. And none of this is good, not good for kids who are out of school and absent of those free or reduced priced meals, senior citizens who can't get to our senior centers for Meals on Wheels programs, for families who full-time job is now a part-time job. So we have some real challenges both at the state and at the federal level.
Well, and I think what we've seen is pretty similar, Lisa, and it's the same population. We're both serving them. We've seen an uptick in people who can't make their percentage income payment plan, their BIP payments. And those are set at a level that, but you lose a little income in the house and you don't have any fat on the bones. There's no way that you can make those payments. The first thing you mentioned too, moratoria are a real concern to us. We know that when Governor Strickland declared a moratorium many years back, that the next day, 17% of the appointments at our agencies didn't show up for emergency energy assistance. They knew that they weren't going to get shut off. And our fear has been, if we can't get people, if these moratoria were to extend, and they're not in Ohio, on the energy side, that'll drive people into the agencies. And we've really got, they call it in healthcare, a continuum of care. But we do have enough benefits and enough programs to really ride people through the winter without any problem if they come in.
I think it's the nature of people. And again, that's the other thing that we're seeing. I mean, in the Great Recession, the last people to show up were the new poor, folks who had never asked for help. And I call those the folks who have traditionally been our donors and our supporters, who were constantly there when we needed them, now having to ask for help. And one of the hardest things to do is ask for help or know how to navigate these systems that are not the most user-friendly, as I think you would agree. The other problem that we have is so much of the work that's being done by our public agencies is they're still closed. So it's by appointment only, or it's by food, or by phone, or they're being driven to internet to make applications. So not having that trusted entity to help them navigate the systems have been a real challenge. We need to do more from a public relations standpoint, and I really worried when we had unemployment benefits where folks were in a feeding frenzy, couldn't get through because of a lack of capacity, both at the call center, but also the online application, that we were not cross-selling programs to families in need, to say, if you're behind in your utilities, did you know about the home energy assistance program? Did you know about the percentage of income plan? Do you know about prevention, retention, and contingency? Do you know about SNAP benefits? So again, it's a lot of education, especially for the new poor who have been impacted by COVID-19.
Yeah, I think that's one of the things. A number of our agencies have gone to consolidated intake. And Community Action works with your organization and with the food banks. But when you have that consolidated intake, then you qualify people for all the programs that they're eligible for at one time. And you siphon them to the things that can help them. But we don't cross over to what's happening at the county departments of Job and Family Services. We don't really interact with them as much as we should. Do you see a coordinating mechanism that's successful out there, that's working in any of the counties to try to get everybody together?
I think scarcity drives a lot of that collaboration, certainly with the Emergency Food Assistance Network. And you're right, we I don't know of a community action agency that isn't running a nutrition-based program, whether it's Senior Meals on Wheels or the Child and Adult Care Food Program, commodity supplemental food, or having a food pantry or a soup kitchen. So there's a lot of cross-pollination that we're doing currently with our community-based organizations. I think we need more with our public agencies, but again, they continue to remain very siloed. A lot of the lessons that are going to be learned in this, but it's unfortunate that it takes crisis before we recognize that this needs to be a center-based. I'd say the ones that are really responsive now have been the managed care companies, because they know for so many of their members that they also may have chronic or acute conditions that they were avoiding seeking health care because of the pandemic. So we've been doing a lot more with them, trying to look at who's coming to the food pantry, making sure that people know that doctors' offices are open, how to get medications that they may have been cutting the dosages. So we're doing a lot more, I'd say, with the managed care companies, because again, we know that diet-related and chronic diseases are one of the major cost drivers, not only of our healthcare system, but also that are driving and exacerbating hunger and food insecurity. But we believe food is medicine, food is health, and that is really important, especially with chronic diseases.
All right. Well, any other last comments for the folks? I think that was pretty much says it all. You got to eat, you got to eat.
You got to eat. And again, we're in this for the long haul. And I have been telling folks that I know that we're all fatigued. We're all frightened, but let's follow and make sure that we're adhering to CDC as far as masking, hand washing, and social distancing. Let's make sure that we're looking out for our brothers and sisters. As organizations, let's collaborate, let's lead by example, and that's going to be the most important thing. And we also need our elected leaders to lead. Charity is not going to fill the gap on this one. We need a public response to many of the issues that we have talked about, and that's going to mean major investments from Congress and at the state level as well.
Well, on that note, we will thank you. I want to thank you, Lisa, for joining me today. Best of luck as we move forward. I think, unfortunately, the one thing you and I have is job security right now.
Yeah. And we've got to continue to advocate to make sure that the least among us, their voices are not lost in this, and that public policy should be driven by what the least of us needs to have.
Thank you, Lisa. Appreciate
safe,
you
be
joining
well.
us.
You're welcome. Thanks for the invitation. Be safe, be well.
You do the same. Bye-bye.